The goal of an accountable care organization is to provide better care. And we do that with coming together from doctors and hospitals, committing ourselves to providing better care for the patient, coordinating care, and to do it in a cost-effective manner. And really most importantly is ensuring that patients receive the right level of care at the right setting.
For an ACO to make sure that they're delivering the highest quality of care across the population, they've got to figure out how they prevent their sickest, most expensive patients from costing them even more money every year by readmitting. And if you don't get in front of that cycle, you really propagate it. And an LTACH can help get in front of that cycle.
The population we serve is oftentimes quite ill. They go in the hospital pretty frequently, and when they move from an acute care hospital, there are several avenues through which they can go prior to getting home.
The LTACH is critical in being able to move the patients from an acute care setting, which is the highest cost, to a lower cost but still a high level of care. And so if you can move them out of that high inpatient cost and into an LTACH, everything helps out.
A fairly small percentage of patients actually go to LTACH, but those patients tend to be the higher acuity patients and tend to be our higher cost patients as well. So it's important to have a partner on the post-acute side, on the LTACH side, who really understands how to operate efficiently and provide good quality care and to keep the cost down across the full continuum.
Kindred specifically as an ACO participant is able to work with the caregivers, work with the upstream referral sources to make sure that the transition from an acute care hospital into our setting is smooth and without delay, and to make sure that while they're in our setting, that we're giving them the right level of care around that accountable care organization's care management objectives.
With ICU and specialty trained staff, disease-specific certification from Joint Commission, we have a lot of clinical expertise in this area. We're a natural partner.
We have found Kindred to be a very collaborative partner, delivering high quality care, very responsive to our patients' needs. We're able to move patients in a very timely manner, and we have a low readmission rate.
Kindred was the first one to come to the table and said, this is the right way to go. This is the future of medicine. I think we're going to end up with a better population, a healthier population.
You really get to know these patients. I mean, if you go to these IDTs, you sit through every single discipline. Every single discipline knows exactly what's going on with these patients and what they need to do and what goals they need to meet to be able to get home. It's inspiring to see that. When you walk up and down the halls here and you see all of the success stories on the walls, these patients really get better. I've seen it firsthand.
Aligning Kindred and ACOs together in any other advanced payment model is really quite straightforward because it's at the DNA of who we've always been. For the sickest patients, we're there to provide the highest quality of care. It's a turnkey solution to bring Kindred in as your LTACH provider, and we can make sure that you don't have to go through that learning curve. We can deliver that to you specifically.
If we're looking at our mission around hope, healing, and recovery, and we look at the core values of the ACO being coordinated care that improves the quality of care and patients' access to the care that they need in a cost-effective manner, there's such commonality there. I can't think of another LTACH company in the United States that has that to offer.